When you first open the EMR, this is the view that you're going to see. Let me orient you to the navigation tools that you've got available. At the very top is a row of drop-down menu items that you can see here. It turns out that you won't use these menu items very often because there are much quicker and easier ways to get around the EMR. In fact, the only menu items from here that I use are this one under Organization, because this is the only place where you'll find Change Password. This one under Report is where you'll find Stored Queries, and I'll talk more about that later. And this one, Window, which is the most useful of these drop-down menus, because this will show you all the open windows in the EMR that may be hiding behind other windows. You can see in this example that while I'm in the Work Center, there's a window in the background, a medical record for a different patient. I could just click on any of those other windows to see where they are. Just below those menu drop-down items is a row of shortcut icons. You can see them here. These first two icons are the most important. This EMR is divided into two main sections. You are either in the Work Center or in the medical record. The Work Center is that area of the EMR where you will do the kind of work that you do when you're not directly seeing patients. That is, phone messages, prescription refill requests, lab and x-ray results that you need to sign off on, consult letters from specialists you need to review, checking your schedule, etc. When you're in the Work Center, these are the shortcuts that you're going to use. In fact, for the Quickstart, you can focus on just these four and ignore these as well as these two other tabs. So if you're not in the Work Center of the EMR, then you have to be in the Medical Record section. When you're in the Medical Record section of the EMR, it means that you're in a specific patient's medical record or chart. The yellow patient information panel will always tell you whose medical record or whose chart you're in. Right now, this patient information panel is blank, and as soon as I click on Medical Record, I get this dialog box, which is asking me which chart do I want to review. I'll put my cursor here and just start typing a name and hit return or search. I can scroll down to find the one that I'm looking for and either double click or hit OK. This patient information bar tells me exactly whose chart I am reviewing. See, the patient's name is here, followed by the date of birth, the patient's PHN, their Paris number, who's been assigned as the most responsible provider, and that's assigned here within the EMR. And then you see the next field, which is PCPOS. That stands for Primary Care Place of Service. You can see it's indicating that Pender Clinic is where this patient receives their primary care. Next you see Alternate Place of Service, and this has a drop down because there might be more than one. This indicates what other teams may be involved in giving other kinds of care to this particular patient. The next field indicates if that particular patient has an appointment booked in the future with anyone within our own EMR. Now, all the other shortcut icons that are in the top row following the medical record are all shortcuts to be used when one is within a patient's medical record. That is, they're all patient-specific shortcuts. There's also a row of shortcuts on the left-hand side in the segment list. And again, some of these are very similar, in fact identical to some of the shortcuts up top. You can think of this segment list as individual sections or chapters of a patient's chart. I'll demonstrate this in more detail shortly, but let me start back with some details about the Work Center. So no matter where you are, you can always hit this button here to get back to the Work Center, which I'll do now. and it returns you to this familiar view. The shortcuts for the Work Center are here along the Segments bar on the left-hand side. Let me walk you through them. The default view is the Today view. This first column shows me patients who are in the waiting room waiting for me. And here you'll find a list of tasks and unsigned transactions as well as recent clients. Looking at my tasks list, there are 2 tasks that have been specifically assigned to me, and there are 4 unsigned transactions which have been assigned to me. Draw your attention to this floating notifications panel over here, which is telling me the same thing, and is supposed to be visible no matter which view I'm in. It's supposed to float over whatever window I happen to be working on. In Windows 7 operating system, this can be a bit glitchy, so it's always useful to come back to the Work Center here to see this view. From this window, you can actually dispense with the tasks that you have to deal with. Let's start by choosing one, just one click. You'll notice that as soon as I did click on it, the yellow patient information banner changed. That's because this task is assigned with a specific patient, and I can see now that it's assigned or linked to this patient. So I'm going to right click and I'm going to open this. I can see that it's a phone call, and here is the message. So I've read what I have to do. I click OK, and then I can go and do it. After which I'm going to come back, right click, and click Complete. Do you really want to change the status of this item to completed? And I'm going to click OK. So I've completed that, and it will disappear off my tasks list as soon as I refresh or go to another window and come back to this one. My next task is ordering MD to review. So I could single click on it and then right click to open it. Instead, I'm just going to double click, and that'll open it as well. This says that the ordering physician is supposed to review this. This is a standard and very common task that you're going to run across. And here in the explanation, I've got a link, which is much better than an explanation. I'm going to click on the link, and you can see the EMR has brought me directly to the result, the creatinine that I was supposed to review here. You'll also note that this link has taken us directly into this patient's chart. I'm now in the medical record view. I've left the Work Center. Let me verify that another way by showing you this. Again, the check mark is I'm in the medical record. In the background, I've got open windows that I've opened before, but you can also see the Work Center. That's where I was last. One other thing to note is that task, which was assigned to me, appeared in my task list in the Work Center. It also appears in the task panel of the specific patient, which makes sense. In case someone else is seeing the patient, then they'll know that there is a specific task associated with this patient. In this view, anyone can double click and open it. You can see it's exactly the same task we saw a moment ago. And also, of course, I can right click, change the status, and complete it. And you can see it disappeared from the task list right away. Now let's go back to the Work Center, and you can see that they're still listed here. But if I hit this refresh button, and you'll see the refresh button is common in so many windows that the tasks have now disappeared off my task list, and I have no waiting tasks. Incidentally, this task notification reminder will refresh automatically in 5 or 10 minutes, or I can again right click, refresh it now, and you can see it's updated. Similarly, you can manage your unsigned transaction list from the Work Center, the Today view of the Work Center. And it works in a very similar fashion. As soon as I single click, the yellow bar changes to reflect the patient that I have indicated. I can double click to open the specific unsigned transaction. You can see that unsigned transaction has taken me to this section of my Work Center, and directly to the specific patient's unsigned transaction, I can click on this plus sign of the test tube to see more information that you normally would have reviewed, signed off, and returned to the front desk staff for filing. Of course, you can do that in the EMR with the ubiquitous right click, going to right click and hit sign, which will make it disappear off your unsigned transactions list. And now I'll go back to my today view to show you. Here it is, the unsigned transaction. I'm going to hit refresh to show you that it disappears off the list. Likewise, I can show you another unsigned transaction. Again, here it is, and again I can hit the plus sign to show you more information. I can then sign them all as a group because they all came in at the same time. I'm going to right click and sign it, and here it is, the sign button. Back to the work center, double click, open up another one, but this one I'm going to handle slightly differently. First, let me click the plus sign, see what we're dealing with, or you can just read it through here. One of the most common things that you're going to do is pass this on for someone else to review as well. Perhaps it's not your patient and you want the most responsible provider to review it, or perhaps the MRP has been away and you want that person to review it when they get back. So this is how you can do that. With a particular result selected, the annotate button appears. You can click on annotate. You'll note that the annotate button is quite close to the sign button. You could have used the sign button to sign off on any of your unsigned transactions, but I used the right click. It does exactly the same thing. When I click annotate, I get this dialog box. You see a number of very common messages to attach to the lab results. I'm going to choose this common one and I'm going to double click on it, and you can see it says regular MD NP to review. That's just like adding a sticky note to a paper result and handing it back to the front desk. So we're going to annotate or attach this message to that particular result, and then we're going to address it to someone or send a task to someone. Click down this arrow. I can automatically add a task for a particular user. In this case, let's do that. Just type in either the initials of a physician that you want to send it to, or an NP that you want to send it to, or a nurse you want to send it to, and then pick them from the short list, or you can start typing their name, and you can also you'll see that their name will appear. And then I hit annotate and sign. I get this message explaining that I'll be signing off all 7 of the results. I'm going to click OK because that's fine. And then I'm going to go back to my today view, click here, and you can see that this has not yet been refreshed. And when I refresh, you can see the 2 transactions that I had dealt with are now disappeared. And I've got a new task. Well, that was the task that I just sent myself. And you can see that it's linking me back to that same result that I needed to review. And you can also see that here in the individual patient's medical record, it's all also listed there. Back to my work center. I want to show you one more very common action that you will do with unsigned transactions. Let's double click to open this one. And I'm going to look at it more fully here. Here's the unsigned transaction. Let's say I reviewed this. I don't want to take any specific actions on this now, but I do want to review this with the patient when he comes in next. In the paper world, after reading this, you might have sent a sticky note on it to the front desk asking them to leave this on the front of the chart, so that next time you open the chart when you were seeing this patient, it would be front and center for you to deal with. The way we do that in the EMR is, again, click on any one of the results in this particular set, click on annotate, choose review at next visit, double click on it. You'll go down, automatically add task for user. Now here, instead of adding a task for myself, because I don't want a list of hundreds of tasks for patients that haven't come in yet that I need to review their results at the next visit, we created a fictitious user called front of chart. So I'm at Pender today. I'll hit the abbreviation for Pender, pen, and you can see it's given me these choices of who to send this to. Double click on Pender front of chart, and then hit the annotate and sign button. And because I've automatically added a task for this user, because I've chosen that, it's going to add a task as well as annotating and signing it. Again, it's telling me that everything in this group of results is going to be added on the same sign-off. I'm fine with that. Let's go back to our work center. I'm going to single click on this to show you the patient's name up here in the bar. I'm going to click on medical record to show you the medical record view to prove to you that indeed in the task list here, or in the task box, you'll see exactly what we had just produced, which was review at next visit. So that whoever comes to this chart next looks up there, double clicks on it, and it'll take you to exactly the result that you want to see for that. Let's return to the work center. Let's hit the refresh button. You can see I've got unsigned transactions, 0, 1 task left to deal with. And that completes the functionality in the Today segment of the work center. Let's go to the appointments. Let me show you a few tools. Along here you can change the views, 1-day view, a work week view, a 7-day view, a 31-day view. I've got open right now the 5-day view, so that can give me an idea of what my week's going to be like. Here's my appointment list. I can see I've got 2 patients waiting specifically for me in the waiting room. Here's another key button. The drop-down arrow here shows you the multi-clinician view. You can see the schedules for that day for who's scheduled to be in the clinic for physicians, who's scheduled to be in for nurses, counselors, nurse practitioners, etc. And some clinics use the walk-in view, which shows all the clinicians who are scheduled to be in that clinic at that time, as well as some generic columns called walk-ins. You should check with your clinic to see if they're using that view. For now, we'll just use the single view, my particular view of my appointments. When a patient first arrives in the clinic, the front desk staff is going to mark them as having arrived. Usually what they'll do is they'll right-click on a particular appointment and they'll click the word arrive here, and you can see that they suddenly get added to the waiting here. And you'll see that their waiting time will appear here. So typically what you'll do when the patient walks into your room, you'll simply open up their medical record, open up their chart by double-clicking on it. Here I'll double-click on this one. And you're taken out of the work center into the medical record for that particular patient. The default view for the medical record is results. But really, you can spend a moment reviewing this, and typically you'll next go directly to the new encounter window. I can hit the new encounter window from here. I can also hit the same button here, whatever way you want to go. But before we go into further detail on these windows, let's go back to the work center. You'll see that it automatically changed from waiting to being seen. That's a tiny eyeball right there. They're now in the being seen column, so that others in the clinic as well as you can track where these patients are. Now if I double click and open up a medical record of a patient who has not been arrived, I'll just do that for a moment, and then go back to the work center, you'll see that they have not automatically been converted to being seen. The only way to do that is if they've been arrived first. And typically that arrival is done, of course, by the front desk. So what else can you do in this window? Let's say in the course of seeing this patient, you want to book your own appointment and see them in a couple of weeks. It's easily done. And the easiest way to do that is first to drag them into the placeholder here. Once they're in the placeholder, you can then move your calendar to wherever you want to go. Let's say I wanted to see this patient on the 19th. I can see here. Then from the placeholder, I can drag them there. Now it's giving you a choice here. You can either move or add a new appointment. Let's click on New. Do you really want to copy this to a different time slot? Yes. And you can see it appears there. So let's go back to today's view. And the easiest way to do that is to hit this little button there that says Today, circled in red. There we are back in the Today view. You can see this placeholder is very handy. We dragged someone into this. You can actually hit the ellipse and it'll bring up the dialog box for searching for a new patient. You can put them in that spot. Let's do that quickly. Search, double click, and there you see they're in that spot, which allows you to manipulate them and create new appointments. If you look over here on the arrow, if I click that, it gives me that list of recent clients that was visible in the Today view. And again, you can just click on one of those and put them in that placeholder spot and use it to book other appointments. So really that's it for the appointment views. A couple of other buttons here. You can magnify or zoom in on a particular time range, zoom out there. One final note, at the end of the patient's visit, you should close that visit. And there's a number of ways of doing that. I can right click here and close attendance. Or you can right click on any of these patients here and close attendance. So now we've dealt with the Today view and the Appointments view of the Work Center. The next shortcut is this Unsigned Transactions shortcut. And you can see I have no unsigned transactions because I already dealt with them through the other window, the Today view. But while I'm here, let me show you a couple of other things in the Unsigned Transaction window. You can see the default is Unsigned Transactions for myself. If I drop this arrow down, I can see the unsigned transactions for everyone in my group of clinicians, and that's called All Permitted. So this will allow me to see unsigned transactions that were assigned to another clinician. This is, of course, how you'll deal with Clinician of the Day. If I'm Clinician of the Day, I would be reviewing the results for any clinicians who are not available in the clinic on that day, and therefore I would use this All Permitted view. But let's go back up to my view. Again, remember you can right-click to sign on these. A couple of other useful buttons. This is the Expand All, so if you've got a lot of results, you may want to expand all, or conversely, you may want to collapse them all. Those are two very useful buttons. The next shortcut in this segment bar are the tasks. Draw your attention to this filter, and in many windows you'll see different filters that can give you different information or present the information in a different fashion. If you click on this, and I can do this here, or I could have done it here in the arrow. It's convenient that you can do it anywhere along that line. Click on this and it shows you the other choices for the filters that you can look at. We try to make the default filter the one that you're going to use the most frequently, but there are other filters in there that you may find very useful. And especially if you work at different sites and have different results coming in from different sites, you'll want to explore these different filters for the tasks. So that completes our tour of the Work Center. Now we're going to look at the second half of the EMR, which is the medical record. This is the view that you first see when you first open the medical record, and you can see that it opens in the default view of the Results section of this patient's chart. Along the side, you'll see that there are shortcuts which will take you to the different sections of the patient's chart. Along the top are another collection of shortcuts, some of which are identical to those on the left-hand side, and some of which are unique. You'll also notice a set of patient information panels just below those. Regardless of which patient's chart you're in, these shortcuts and patient information panels will always remain available to you. This is the area of the medical record window which will change depending on which section of the chart you're in. Let's take a quick look at these medical record shortcuts. These are the shortcuts that are common to both sets. You'll note that New Encounter can be found in both lists of shortcuts, as well as Review Encounters. Likewise, Review Results is found in both places, as is Documents, Problems, and Care Plans. There are some unique tools across the top here, the most useful of which is this MediNet button, which will take you directly to a patient's PharmaNet record, and this Messenger button, which acts as an instant messenger within the EMR, just as it does on your phone, and this button, which is used to create specimen labels for your patient. Next, we'll do a quick run-through of the different sections of a patient's chart, and we'll start with the top one, the summary. On the summary page, you'll find exactly what you'd expect to see, but I'd like to point out but this is the only place where you'll find immunization history. All immunizations are supposed to be recorded in the PARIS system, and therefore we only bring in a summary of the patient's immunizations, and the only place that we could bring them in from PARIS was in this particular window. Next is a listing of the encounters. On the left-hand side is a listing by date, and on the right-hand side is the expanded view of those encounter notes. Looking at this list of encounters, you can see why it would be important to accurately title each of your encounter notes with the correct problem. It will make it so much easier for you to find in the future. Also note this filter is set to find the last 40 encounters. If you want to go further back than that, you can simply change the filter here. Next is the medication section of your patient's chart, where you'll find usual meds, prior meds, and a list of discontinued meds. I won't spend any time on this view because you'll access the medications most often from the new encounter window, not this window. Next, we'll look at the care plan section. In our EMR, a care plan is a collection of interventions or a set of interventions. And an intervention is a reminder to recall the patient for a specific reason. For example, for this particular patient, the clinician has set a reminder to recall this patient on an annual basis for a chest x-ray in order to follow up on a nodule. Other examples of specific interval interventions or recalls would be pap smears or fit testing. So then the simplest care plan would consist of a single intervention or a single repeating recall. More complex care plans would consist of a group of interventions. For example, you could enroll someone in a hepatitis B vaccination care plan, which would consist of 3 separate interventions or recalls representing reminders to call the patient in correct time intervals. If a patient has an intervention coming due, it will appear here in the notifications box, so it's visible every time you see the patient. It will only start appearing in the notifications panel in the 30 days prior to when it is due, and it won't disappear from the notifications panel until you have actively completed the intervention and reset it to repeat in the next time interval. So the notifications panel will tell you if your patient has an intervention that is about to be due, and the care plan section of the chart is where you would go to see a complete list of interventions, even those that have been completed in the past or are coming due too far in the future to be actually in the notifications panel. This is the problem section of the patient's medical record, but here you can see that we try to pack as much information as possible into the patient's problem list. This is a problem-oriented electronic medical record. You can see that all the diagnostic chronic problems are linked in the background to ICD-9 codes. This section of measures gives you a listing of all the significant clinical measures that you entered into any encounter note at any point in the EMR. It will automatically pull them out without you having to do anything. And you can change the axis of how these are displayed by clicking on these arrows. And you can choose a set and you can graph them. And you can change the time frame here. Flow sheets, if the patient has a particular flow sheet, which is a collection of usually lab results, you'll see them here. This patient has a diabetes chronic disease management form flow sheet, and you can see it gives you a view of their results over time, and again you can graph these. This is the results view of the patient's medical record sorted by date. You can see here again, this is the expanded view. If I want to collapse them, I can just hit collapse. I can get those just the dates for quicker sorting. Here's a documents view, any documents that have been imported on this particular patient. These documents are also available in the results view. But if you want to search for a document, it might be best to search in this view. These are the tasks for this particular patient. So these are all tasks for this patient. You can change the filters to get something more useful for you if you're looking for something. Referrals. This will give you a view of referrals for this particular patient. You can see some of these are meaningless. These are the Paris inward referrals directed in. Probably you're going to want to look at the outward referrals. These are going to be the most useful for you. Forms, this is a section on any forms that have been written for this particular patient. Here's the new encounter, which I'll skip over. I'll come back to that. Here's an audit shortcut. This will show you a list of anyone who's looked in this particular patient's chart, the date they looked in, the time that they were there for, and what computer they did it from. It's a reminder that you should only be looking in charts which you are authorized to look into. And then the final segment here is the care team. This is where you'd find a listing of names and phone numbers, perhaps addresses or fax numbers of people that are involved with your patient. Let's go back then to the new encounter. You can again hit the button here. You find the same button here. The new encounter window will open. You'll notice in the new encounter window that the patient information panels and the shortcuts along the left-hand side all remain visible, just as they have for every other section of a patient's medical record. The only difference is that the short icons on the left have been shrunk to make room for the Actions panel, a panel that is only available in the New Encounters window. When you first open a new encounter, you're taken to the Review window of the new encounter. If you don't know this patient, you may want to start by looking at this section and reviewing their chronic medical problems and medications. In this panel, you can review the most recent notes that were written on this patient. In our EMR, clinical notes are referred to as contacts. So you can see this section is called Recent Contacts. You should also review any tasks that appear in this panel. And the easiest way to do that is to double-click on the task itself, which opens this view. In addition to the task box opening, you also get this warning dialog box, which is asking if you want to modify the task by linking additional data to it. Simply click Don't Link or Cancel to dismiss the warning. Now this is an example of a very common task, which is similar to what used to happen in the paper world when you would open a patient's chart to find a lab result that you wanted to remember to review with the patient on the patient's next visit. So here is the title of the task, which always appears here, as well as a direct link to the lab result that you need to review here in the explanation section. You'll note that the task was assigned to a fictitious person that we called Pender front of chart to ensure that the task would appear here in the patient's tasks box without cluttering up any one clinician's individual task list. So now simply click on the blue link and you'll be taken directly to that patient's lab result. After reviewing it, click here to return to the patient encounter window. If you do complete the task, don't forget to remove it from this panel by right-clicking on it and choosing Change Status to complete. When reviewing the patient's problem list, there's an option which will allow you to easily find all the contacts or notes related to that particular problem. After you click this dynamic checkbox, the Recent Contacts panel will show only those contacts or notes which are related to whichever diagnosis you highlight in this panel. So let's start writing a note, or as the EMR refers to it, a contact. The easiest way to begin is to choose a problem title from the list of the patient's chronic problems and simply drag it up on top of the default problem 1. You can see that it changes to reflect the new title of the contact which you've chosen. One thing to note is that after you drag it to its new destination, the problem reverts back to the underlying hard-coded ICD-9 version. This is unfortunate and something we hope to change in future upgrades. Now we're ready to begin typing an encounter note. You can just begin typing your note, or you can use a shortcut to produce a typing template to make information entry easier. One of our simplest typing templates is the SOAP note. Typing P / produces this one. All the typing templates contain these chevrons, which is what you use to tab through the document. But instead of using the tab key, you have to use F4, which acts just like a tab key in our EMR. The F4 brings you to the next set of chevrons, highlighting them as it does so, which means you can start typing directly over the chevrons so that whatever you type will replace the highlighted chevrons. Incidentally, we have two SOAP note typing templates. I've shown you P backslash. The second one is AP backslash and separates the assessment and plan sections instead of combining them. Whichever one you use is a personal preference. We have about 5 pages worth of typing templates, and you can find a master list of them in the clinician reference section of the EMR. Go ahead and print the list to see which ones you may want to use. Included in that list are some which retrieve your patient's last specific lab values, like last viral load, last CD4, last GFR, or last urine drug screen. Switching back to our note, let's say this is all we wanted to write. I can just close it by clicking here. Note that if I click this X, it closes just the encounter and not the patient's medical record. If I clicked here, it would close the patient's whole medical record. No matter what you do, the EMR always auto-saves or asks you to confirm a save. Since I only closed the patient's encounter, the EMR still shows the same patient's medical record in the Review Encounters window, and you can see my last note here. Let's write another note. Let's say this was a more complicated visit and involved a few different issues. Again, drag the relevant problem title on top of problem 1. Create your SOAP template with either P backslash or AP backslash. After finishing that note, next you may want to deal with the patient's chronic back pain. Just drag that title from the patient's problem list and let go of it anywhere in the new encounter window. The EMR will automatically create a new contact with the correct title. After finishing that note, you may next want to document on an issue that is not in the patient's chronic problem list. Let's say the patient has cold symptoms and you just want to title this contact as cold or cough. The easiest way to do this is to go up here, click on the New Contact button and start writing. Note that if you don't manually change the default title of problem 3, the EMR will automatically change it for you after you close the note by converting the first line of your note into the title of that contact. So, if you haven't changed the problem title, you should write the first line of your note knowing that it will become the title of that contact. In this example, I used the word cough. Let me show you what that looks like after you close the encounter. Here's the list of the previous encounters, showing the encounter I just wrote with the 3 different contacts and their titles. Here's the expanded view of that encounter composed of all 3 contacts. Returning to the new encounter window, let's go through the tools available in the Actions panel. The first is the Scripts window. The easiest way to write a new prescription is to drag the items from the usual meds to the current order panel. If the medication isn't there, or you want to prescribe another one, simply start to type in the new prescription window. You can type in the whole word or just a part of the word and then hit return or click on this ellipse. In this example, I typed in the first part of the word Tylenol and got this window. This part of the window shows me the different preparations that contain Tylenol. This panel gives me drug prescribing information for any med I might have highlighted. The bottom panels show me the label warnings for this medication, and if I wanted to print information for the patient, I would click on this button. To continue with my prescription, I hit the plus sign of my chosen medication and next click on New Instruction to get this prescribing window. These are the only fields that you need to fill in. The rest are not needed. Start with the dose. Here I'll change the default of 1 to 2 tablets and begin typing TID, which I find easier than using the drop-down choices, and then start typing the word oral here. I'll click here to make it PRN. Add the total quantity, and now the minimum requirements for a prescription are met, and the OK button turns blue to signal the prescription is ready. Note this free text field where you can add any further instructions you like. Click OK and you can see it's been added as the 3rd item on the prescription. Note also that you can search for a medication using brand or generic names, but the EMR automatically converts all prescriptions to generic on the final prescription, unless you override that feature on the previous window. Also note that in the frequency field, I could have typed OD. However, as you know, that is considered a dangerous abbreviation and shouldn't be used. Use the word daily instead. Now that your prescription is complete, hit Print here. Note that if you want to print the prescription at the end of your visit and go on to writing a lab requisition or something instead, when you try to close the encounter, the EMR will ask if you want to print the prescription at that time. Also note that your prescription, like every action you do, is auto-saved in the encounter without you having to write it into your note. The next item on the action panel is the pathology tool, which you use to generate a lab requisition. You simply drag and drop the item or double-click on it to add it to the requisition. If the list isn't alphabetical, click here to sort by name. Once you've done that, you can either scroll down or type in an alphabet letter to jump to that letter in the list. Another method is to click on the Find tool and type the test in and then click Find, and then again either drag or double-click. There are also some ready-made order sets. Scroll around to see what's available, and again you drag or double-click. Once they're in your list, you can always delete or add individual tests for your patient. Click Print here to print the requisition, or wait until you close the encounter to be prompted to print it then. Next is the radiology requisition. It works exactly the same way that the pathology recs works. There's a little bit more complicated when you're wanting to do CTs. So for example, let's just double-click on a CT of the head. You'll see some embedded instructions in this one. It says office use, type CT / into clinical details, fax to book, and give a copy to the patient. When you type CT / you can see that it creates a typing template for you to fill out some more information because a CT scan requires the additional information. It would automatically pull in the GFR and embed it into the typing template for you, and in fact this is saying that was not found, when you can see, if you look closely here, that the GFR was actually entered, but you can see that it's too old, December 2014. That's why it's being rejected, and you're getting this warning saying that the creatinine GFR was not found. I'm going to hit OK to dismiss that, and we finished our form here, and we can just print this. The next tool on the action panel is called calculators. These are self-evident, and you can explore them on your own. After that is a tool called Reference Series. This is a tool which will plot your patient's weights and head circumference on a standard growth chart. These will only appear if your patient is in the right age range. The next action panel tool is called Referrals. In this window, click on New Referral, say OK to saving your encounter first, and you'll see this window. We use this only for external referrals, so you can ignore these fields. Start by typing in the name of the clinician you want to refer to. This list is from the College of Physicians and Surgeons. You could also choose a category of specialist instead, like cardiology or neuro, etc., and leave it up to your admin staff to find an appropriate specialist for you. Next, you add a pertinent diagnosis. This first field forces you to choose an ICD-9 diagnosis, but this field lets you type anything. Next, expand on the reason for the consult by typing here in the narrative field. Next, you can type any instructions for the front desk staff who will handle this referral for you here in this text box. You may want them to send a copy of the CT report, for example. Next step is to review the letter being created by hitting this tab. You can see this template has added your narrative in the reason for referral section. You will also note that this template automatically adds the patient's problem list and usual meds for you. A word of caution: don't try to modify your narrative in this window because the changes won't stick. You need to modify it in the place you wrote it, the General tab. Finally, hit Save and Close, and that's all you need to do. Your admin staff has a workflow which will take care of all of the next steps involved in this process. Our next tool in the Actions panel is Forms. We have all kinds of forms loaded into the EMR. Our aim is to be paperless, so really any form you had on paper should be available in the EMR. Normally, you'll select your forms from either your most frequently used list or from this search window. But to give you an idea of what's available, I'm going to hit the Browse button. Under Investigation Requisitions, we have a variety of requisitions for tests which require that you use a particular form, like Holter monitor, bone density, or nerve conduction studies. Under Evaluation Tools, you'll find the CIWA, MOCA, GAD-7. Under Referral Resources, you'll find hospital-based programs that want you to use their forms for referrals, like the Cancer Agency, the Diabetes Education Center, or Oak Tree Clinic. Under community-based programs, you'll find Home Health, Loving Spoonful, or the DCHC MAT program. In clinical docs, you'll find the Hepatitis C forms and all your methadone forms. In third-party documents is where you'll find disability forms or pharmacare forms. Let me show you a few sample forms. The easiest way to find them is to use the search button and type in any word or part of a word that you think might be in its title. Here I'm looking for a disability form. Double-click to open it. You can see that the form is identical to the paper version. You can fill it out here in the EMR and print it out to hand to the patient. The EMR will auto-save it for you in this patient's chart. Once you've used a few forms, they will appear here in your Most Used section, making it easier for you to double-click and open them. This is the methadone prescription form. We create it here as a form instead of in the script section because it must be printed on your duplicate prescription paper, which you will feed into the single sheet feeder of your printer. Start by typing in the patient's dose. Pick a start date from the drop-down calendar, likewise an end date, and you'll see the amounts are auto-calculated. Click DWI and you're done. You could free text in this field if you like. We also have a duplicate form for other narcotics. Note that the next time your patient comes back, you can retrieve this form by clicking on the blue link in the saved encounter, making it very easy to figure out what the next prescription start date should be. Returning to the Actions panel, the Letters section contains some standard letter templates that you might find useful. You can browse these on your own. The Client Information section contains patient handout materials that you can print and give to your patients. This section works just like the Forms section. You can browse or search. When you click Browse, you'll see that the handouts are organized via system. Again, you can explore these or search for a topic in the search field. The Clinician Reference section is set up exactly the same way, and here you can find all kinds of useful information such as clinical guidelines. These might be in the form of PDFs or websites. Here is also where you can find help files. In this example, you're taken via a link directly to the video help files. Again, you can hit the Browse button to see what kind of things are available. The next Actions tool is a Care Plans and Tasks button, and as you'd expect, this gives you a slightly different view of this patient's care plans or interventions, as well as any tasks that are due. Note that this view of care plans and interventions includes upcoming recalls that are too far into the future to appear in the Notifications panel. The next tool in the Actions panel is called Add Adverse Reaction. Even though creating an allergy in our EMR results in a new problem for your patient called Adverse Problem, this window is the only place where you should record allergies. The reason is that in order for the allergy to trigger a warning when someone tries to prescribe that medication for your patient, the allergy must be properly linked to the correct medication, or more often, the correct group of medications in our formulary. The Adverse Reactions window will give you a pick list of the most common allergy choices that are correctly linked. Simply highlight one of the choices and hit the Add button. You will also be prompted to include the nature of your patient's allergic reaction to complete the process. If the allergy you're looking for isn't on the common allergy list, you may need to create your own. You can do this by clicking New. You'll then get this window. Now, before you can start searching for the correct medication, you have to change the search window from ICD-9 codes to the formulary list by clicking on this ellipsis. Now you can begin typing in the medication name in this window. You can verify that you are searching the formulary. If I type codeine here, I get this list of many codeine-containing preparations. Note that this symbol denotes a single preparation. If I scroll down further, I get a list containing this symbol, which denotes a group or family. I'm going to want to choose the most inclusive group of codeine-containing medications, which in this case is this one. I double-click and get this window. If I try to click OK at this point, I get this warning, forcing me to indicate what kind of allergic reaction my patient has. To enter the information, I have two methods to choose from. The first is to choose from a ready-made pick list in this field. Or I can free text whatever I want to in this field. Click OK, and you can see that you've added the allergy here and here. Note, if your patient has no allergies, the best way to enter this information is to check this tick box. You can see it immediately updated the patient information panel here as well. Note also that this identical checkbox is available in the scripts window as well, where you can most easily record no allergies. This ends the Quickstart tutorial. Thank you for watching.